you so much, and thank you for having us here today. I'd like to lead off by quickly just sort of throwing the floor to my fellow panelists and asking them to quickly intro themselves, and then we'll dive quickly into the topic at hand today. Maybe we'll start with you, Dr. Sarper.
Introduction. No, good afternoon, everyone. I've been in the healthcare sector for 30 plus years in management. I came to UAE 2004. I was more on the operations side, like building up Dubai Healthcare City, many different projects. But then I moved to a little bit on the telemedicine, started really using 5 years ago, and how can we reach out to the patients with chronic disease, the solutions that are available at that time. And then moved into a little bit more on the investment side of things in digital health. And lately the company that I manage is focuses on digital health solutions. Try to a little bit of bring the already commercialized, tested, validated solution from the globe to our region to help to leapfrog the entire transformation.
Thank you, Dr. Sarper. Dr. Mohammed.
Hello, my name is Mohammed Amin, and I'm an MD by education. I started my career building healthcare organizations, different models of care, clinics, hospitals, labs. In the course of my career, we built the biggest chain of labs in the Middle East. It's called the Burg Laboratories, and we built a quality of life enhancement group, especially on sexual dysfunction, called Elaj Medical Centers. Then we moved to integrated care networks building now in Saudi with the transformation of healthcare into integrated care networks. We built something called general network of healthcare providers, where tertiary care hospitals with secondary care hospitals, primary care, diagnostics come all together to provide value-based healthcare. And we're moving, especially in Saudi under Vision 2030, into value-based healthcare very quickly. And I'm honored to stay on course to meet this challenge and to join technology with healthcare and the transformation of healthcare. Thank you.
Thank you, Dr. Mohammed. Khaldoon.
Good afternoon, everyone. It's a pleasure to be with you today, and it's a pleasure to be on this panel. My name is Khaldoon. I'm the co-founder and CEO of Alma Health. Alma Health is a digital healthcare provider on a mission to transform the lives of the millions of people living in this region with chronic conditions through improved clinical outcomes. I'm not an MD, I'm not a healthcare professional. I'm actually a technologist, and would love to talk to you more about the partnership today and about how Alma Health would like to integrate with the partners in the industry.
Sophie?
Good afternoon, ladies and gentlemen. And again, thank you for having me. I am the founder and CEO of Nabta Health. We are a hybrid and holistic healthcare provider for women, focused on accelerating the detection, diagnosis, and treatment of chronic diseases in women in emerging markets. We were the first femtech, or women's health technology company in the Arab world, founded in 2017. We are still one of very few companies that was built here and conducted a substantive period of research and development, also here in the region. We focus on addressing some of the systemic gender and racial biases that we know exist in healthcare today. We also had the somewhat dubious privilege of coining the term hybrid healthcare back in 2018. So a couple of years pre-COVID, and back then, if you can think back that far, nobody believed that a hybrid healthcare model was the future. Either you were focused on telehealth or you were providing traditional healthcare, but never the two did meet. We actually published a book with Springer on hybrid healthcare earlier this year, with contributions from some of the biggest thought leaders around the world that has been referenced now by multiple bodies, actually by Forbes, by the Harvard Business Review and others. And we're very excited to see the now rapid adoption of similar hybrid healthcare models across verticals within the UAE and beyond.
Thank you, Sophie. Maybe I'll start off with you. And if you can please provide us with a bit of an insight as to your perspective on what makes a healthcare startup next generation.
That's an interesting question. I think when we think about next generation anything, we tend to get caught up a little bit in the delivery mechanism. in the technology at hand and often in the latest trends. You know, this year it's the metaverse, dial back a couple of years, it was blockchain, it was AI. And actually, if you're working in healthcare, next generation just means companies that are working in a more cost and time-effective way to solve some of the unmet needs and biggest challenges in healthcare. And in this part of the world, in the Middle East, Africa, and South Asia, those are very different country by country. Every government has its own kind of order of priority in terms of chronic disease management, for example. It's actually important as a next-gen health tech company to be agile and localized ahead of anything else, and to be able to work with the infrastructure you have at hand, as opposed to trying to retrofit particular technologies or techniques to fit a specific region.
Khaldoon, with Alma Health being a platform, what are your views on that, and how can the platform model differ or enhance on what Sophie was saying?
Yeah, I mean, I completely agree with Sophie's answer. I think it's important to remember the patient and what problem are you solving for the patient, whether it's a female patient or a patient living with a chronic conditions. I think there's a lot of technologies available out there. I think there's a lot of companies in tech, whether it's a logistics company or a marketplace like Amazon, going into healthcare and offering a wide range of healthcare services that makes the experience for a patient more convenient. But I believe that it's not just about a seamless experience, it's actually about improving clinical outcomes. So that means for someone living with diabetes, as a digital healthcare provider, are you actually helping that patient reduce HbA1c? So it's important to not get caught in the trends. It's important not to get caught in the new technologies that are available in the market. It's important to solve for the patient and always tackle a problem that the patient is facing.
Very interesting. Dr. Sarper, I guess picking up on one of Sophie's coined terms on the hybrid side, and given your career and what it spanned from a hybrid perspective, how do you see the engagement happening between incumbents and players?
Yeah, actually, if you look at it, when we actually talk about digital health, the span of the technologies you're talking about very wide, because we end up, in my opinion, coming back to the reaching out to the patient experience, their journey through the whole disease and how we manage them and how we do that. This is excellent. But also there are other technologies we heard throughout the entire day and a future coming through the diagnostics, therapeutics, and all of that. So when we really talk about digital health, then we really need to talk about all of these at once. Because then how we do the hybrid becomes very critical. Because when you have so many of these solutions, either globally or now we are companies like Alma, Nabta are all coming up from this region, from our country here, is wonderful. But without connecting that back to the service, it becomes at the surface. So the hybrid, meaning that we need to deep dive on the problem. The problem is not only digitizing the problem. The issue is that how we can look into the entire flow of the engagement, not only the patient, but also the entire ecosystem. So when we talk about the hybrid is really critical because what happened, if you look at this story, is like with the major telehealth companies from UK and US that raised the billions of dollars, they became unicorns. They started as a health tech company and they had an amazing technology, but they started adding the providers and they become a service company. Vice versa, when we look at all of the operators in the healthcare space and when they look at the conventional way of delivering care, they realize that they have to put the digital on top of what they do. So that one way or another, either you come from tech down to hybrid or you come from the conventional, put your enablers and overall do that. So when I look at it, it's like really hybrid is a way because adaptation, not only by the patients or users or members, whichever you call them, because you're going to not managing a sickness or disease, but also managing the health and well-being, then adaptation is an issue, for sure, for our region, but also adaptation of the providers is an issue. And you can have your CMO, CEO, amazing leadership in a hospital to do the digital transformation. But when it comes to one physician, you cannot move forward. Other way around, you might have a champion physician to implement certain things in his entire patient flow, then you stuck with the finance department because they're looking for a reimbursement to be able to execute that. So hybrid is the way to go for multiple reasons that we can really adopt the technologies overall. But it needs to really not stay on the surface, it needs to go down deep dive. We need to look into that overall. And that means academic involvement, like as Nabta he talked about, is that Sophie talked about, a lot of research needs to be done. That means we need the academics to get involved at how it works, what the outcomes. We're talking about value-based care. Everybody's going to look and ask me, okay, value-based care, but what are the success stories on this? So we need to do a lot of research to be able to do it. Where is it going to happen? It's going to happen, comes from the academic, comes from the government. So such ecosystem is critical. But digitization versus digital transformation, we should talk about. I mean, we use big words like digital transformation. What does that mean? What is my KPI to then I will say I digitally transform the entire system? When we talk about medical technology, we talk about disruptions. They come in, they probably solve an issue like a cell and gene therapy, like treats the cancer, right? That's a disruption. But when we talk about digitalization, digital transformation, we cannot talk about disruption yet. We can only talk about innovation in a certain place that you can innovate. There could be innovation for you, but not disrupting the entire health ecosystem.
Very true. I'd like to pick that up and build on it with Dr. Mohammed. You mentioned value-based care. You spoke about what the group is doing as an incumbent and a true incumbent in the space, spanning multiple geographies from Saudi, Egypt, and across the entire region. You also touched on value-based care as a key component, and I think Dr. Sarper was just alluding in it. I'd love to pick your views on that and how you see that ultimately playing a key role in partnerships between incumbents such as yourselves, and what are the ways that you can revolutionize the entire way that the industry is moving?
I think this is the challenge facing healthcare today. طبعا, we are in a transformation period, and I don't like to call, the disruption idea of healthcare. It's an evolvence of the healthcare itself, because you're working with humans. If humans are not going to be disrupted and be something else. Technology, to me, is an arc for healthcare to take, the existing challenges of healthcare, which is continuous rising costs of healthcare, and the second issue, that health as is not an issue for patients anymore. Health is an issue for every humans, especially after COVID and after the biological age we went through. People are now much conscious about health and much conscious about staying healthy, not getting sick. The major challenge today for healthcare industry is to help people not to get sick. And this is the promise of technology and connectivity, where all this solutions on table can come and integrate with the legacy system of medically, because you have a medical part. A medical part is still a medical part with the drive of technology in the medical part. But if we're talking on a wider domain, which is healthcare or fighting even to decrease cost of care, if we're talking about value-based healthcare today, the emergence of population health management as a solution today to cut the cost of care, because the reactive way of delivering healthcare, that what they like to call it, the incumbents are doing, it's increasing, because you're finding you're spending billions on solutions in biosimilars, technologies, robot. This is all comes with a cost. Yes, you're improving the outcomes, but you're paying much more money. And if we give an example, مثلا for cancer prostate today, the golden rule for cancer prostate today is robotic surgery. The robotic surgery will cost you more than the normal surgery, maybe 3 times. Now, yes, you improve the outcomes, but you increase the cost of care. The idea is to use the technology mainly, and this is what Google and Apple and the new big tech companies are focusing on the health itself. فاحنا we're mixing between health and illness or wellness and illness. I think today, حتى even in the favor of incumbents or real healthcare typical providers, when the patient come with a healthcare problem and he's in a good health condition, the outcome is much better and the cost is much less. I think the way to do it, and this is what the big organization now doing worldwide, is to go for the full value chain. We did from our side 2 years ago, we started Al-Borg Accelerator, and we put $1 million as an accelerator for the startups, and we run a year program, and our demo day was in Riyadh last January. Our next demo day is next January. It was very successful. It was very targeted to integrate, because we don't want just to help them with money. No, like Dr. Sarper said, no, we enable them. We direct them where it's needed. Like Khaldoon said, I like what he said, that we started around the customer itself, what the customer or what the patient needs, and we build accordingly. Medicine is around the disease, healthcare is around the consumer, or I don't like it, call it the patient, because patients are very limited number. They always tell us in healthcare that patients at any given moment is 1% of population at any given moment that needs healthcare, but the full population needs continuous healthcare. We started with this accelerator, and I was inspired by this idea from Mount Sinai in US. They started, I was with them, and I saw the idea working, and now after the success of this accelerator, and we pick up some companies and they are working with us, and we give them business, and then we started now a VC called Life Venture. It's focused on healthcare. It's a $50 million fund focused on healthcare, and this is what should healthy incumbents do. Because they cannot leave treating patients and go and compete. The competition between the disruptors, like you said, or the digital companies and the legacy systems, it's not in the favor of the industry itself. The integration between them by working together, and I always say that on this day we can help those companies to come. Maybe after 10 days, those companies are going to come and buy the incumbents or the big healthcare organization.
No, I hear you. And just to pick up on that very quickly and to zoom into Khaldoon, you want to talk about the benefits and the challenges of engaging with incumbents? And I know that Al-Borg and Alma, for example, are collaborating together. So maybe we can use that as a starting example, then talk about the benefits there and the challenges that you face.
Absolutely. So going back to the same point around member experience or patient experience and building products to solve for that. So we are in the business of transforming lives for people living with chronic conditions. And that means offering them, again, not just a seamless healthcare experience, but also an experience built around improved clinical outcomes. And to what my colleagues had said, that means making bold business decisions at an early stage of the company in order to solve for that specific problem. So at Alma Health, for example, we went and built pharmacies dedicated for people living with chronic conditions. We went and launched digital clinics in the markets that we operate in, Abu Dhabi, Dubai, Egypt, and soon Riyadh, again, to control that experience end-to-end for someone living with a chronic condition. And we realized very quickly that we can't do everything by ourselves. You have to partner. You have to partner with existing providers such as Al-Burj. You have to, of course, partner with the payers so that the whole experience end-to-end is not just seamless, but it's also fully covered by the insurance patient. And, of course, you have to be regulated. So you have to work very closely with the different departments of health, the different ministries of health, and the jurisdictions that you operate in. So the benefits are massive. They are enablers of your business. They lower your customer acquisition cost. They lower your OPEX costs. And this is a great example of how we partnered with Al-Burj to do at-home sample collection using their already existing infrastructure in Abu Dhabi, in Dubai, as well as in Cairo. And we were just talking about a potential partnership in Saudi as well. So for a company like Alma Health, a startup, limited resources, this is a huge enabler for scale. Of course, as a startup, we have to run fast. We have to be faster than anybody else in the market. And those are probably the biggest challenges that we face. How do we set our pace as a young, energetic, highly driven company, highly focused company? How do we set the pace to work with the different stakeholders that have a different way of working in healthcare? And I understand why it's a different pace, again, because this is healthcare and this is people's life at stake.
Well, I get that. And I just wanted to, I know we're short on time, but I just wanted to quickly jump to Sophie and say, do you find that the nuances are different when you're operating in, for example, femtech as a specific segment? And can you build on what Khaldoon was saying there, particularly on the challenges side?
So obviously I'm biased, but I think we operate in one of the most exciting, because it is one of the least tapped segments in healthcare in the world. Women were almost wholly excluded from clinical trials until 1993. Still today, women only account for 19% of clinical trial participants globally, and 92% of those trials occur in the US and Europe. The remaining 8% mostly occur in the Far East. What that means is that there is only a tiny percentage today of clinical trial participants that are of Middle Eastern, African, and South Asian origin, meaning that the vast majority of drugs, procedures, clinical pathways, diagnostic tools, treatment options are not designed and built for women from this part of the world. And that's a huge gap and a massive opportunity. The next billion people are coming out of Africa. The nexus of power is shifting from the west to the east. And at some point, it's going to become increasingly important to build things for people that actually work for people here. Coming back to the point about chronic disease, so within femtech, which is estimated to be worth $1.136 trillion as a market by 2027, the greatest segment is in chronic disease management, $218 billion. Only 1% of femtech companies focus on emerging markets. Only 1% of those focus on chronic diseases, and it is the greatest single threat to healthcare systems today. I think the biggest takeaway from the pandemic is that actually our established healthcare ecosystem is very well set up to deal with acute disease. The response to the pandemic in the context of COVID-19 was phenomenal. What the healthcare system was not set up to deal with was that acute disease management at scale. And the reason it had to deal with it at scale, the reason we went into lockdown, the reason there were so many kind of implications at a micro and macroeconomic level was because a significantly higher percentage of our population is accidentally unwell than we believe. In the US, for example, there was a perception that only 10% of the population was at risk, the sort of 10% of the over 65s, but actually 88% of adult Americans live with at least one chronic illness, insulin resistance, which is there in 2/3 of normal weight adults and over 90% of obese or overweight adults. So the at-risk population in the US was not 10% over 65, it was almost 9 in 10 adult Americans. And when you have that scale of accidental illness, it means that it doesn't matter how many vaccines we develop, how many lockdown procedures we evolve, if another pandemic, if another novel disease penetrates our society, we will suffer the same fate as we saw during COVID-19 of a severely accidentally unwell population being forced to isolate for potentially years at a time.
Thank you. I think that's all the time we have. I have Omar here staring me down. So on that note, I guess we can, do we have time for questions, or are we? Sure.
Any questions, ladies and gentlemen? Anybody else? No, I'm joking. Can we give her the mic, please?
Hi, so it's great that you're talking about partnerships. So my question is, what are the benefits that you negotiate when you look into a partnership, and when do you decide that you have to break it off?
I guess I'll take the tough questions. So, again, it's all about the problem statement and making sure that you and your partner are solving towards the same problem while adding value to the whole ecosystem. And I think our partnership with Al Burj is a very clear example where we are offering someone living with a chronic condition with a seamless experience to say renew or refill their prescription from the comfort of their home. And when we looked at Al Burj, we looked at the infrastructure that they had developed in the different markets that we want to target and we are targeting. It was a natural partnership. It was a natural selection. So it's always important, you know, there's going to be a lot of paperwork involved, there's going to be a lot of negotiations involved, but if you don't start off on the right note, and if you're not sharing the same values as two healthcare providers around building a solution for the patient and nobody else but the patient, I think you'll suffer. So it's important to have shared values, and it's important to always keep in mind that this partnership is adding value to the entire ecosystem.
I think for us, we look for alignment on two key things for partners, and all of our partners are long-term partners. One is a real desire to materially improve health outcomes for populations in the region, understanding that every country has its own healthcare needs, its own cultural preferences, and that you'll have to adapt and accommodate for those. I think the second thing is an ambition to be globally disruptive. You know, the healthcare system today is still predominantly focused on foreign direct investment and bringing companies here, whereas we strongly believe that because of its geographical placement, because of its desire to innovate and to lead, the UAE and the GCC more broadly has the potential to become a global hub for innovation in healthcare, not just for emerging markets, but for the world. And so for any partner that we approach, that desire to build something that can become a global export is really key.
I think that's all the time we have. Thank you so much, everyone. Thank you to my fellow panelists. Appreciate it.